Good afternoon, and welcome to the Board of Health meeting of August 15th, 2022. Please note this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone is recording the meeting, please notify the chairman. Pursuant to Governor Baker's July 16th, 2022 signing of an act relative to extending certain COVID-19 measures adopted during the state of emergency, including the extension of the March 12, 2020 and July 15th, 2022 orders suspending certain provisions of the open meeting law, General Law, Chapter 30A, Section 20, until March 31st, 2023. This meeting of the Chatham Board of Health is being conducted in person and via remote participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling 1-508-945-4410, and the conference ID is 351-171-351 #, or you can join the meeting via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Channel 18, despite our best efforts, we may not be able to provide for real-time access. We will post a record of this meeting on the town's website as soon as possible. And now I'll turn the meeting over to Chairman Dr. Hanson.
It shall be the policy of this board to conduct its meetings under the open meetings law so as to encourage public participation whenever time permits and as part of agenda item discussions. And we have made mask wearing voluntary for board members during the meeting now. We have 6 items on our agenda. And first we'll take a vote of a quorum. Those, when I call your name, say present. Carol Boyce?
Present.
John Beckley?
Present.
Ed Sheehan?
Ed?
Ron Broman?
Present.
And then we have 2 alternates. Carol Gordon is here in the room, and Dr. Edwards is here by video. Okay, so the first is a variance for 67 Capri Lane with Clark Engineering, I think representing them, and if David is here, he can present the case.
On the phone, can you hear me?
Barely.
For
Better.
record, David Clark, Clark Engineering. This is a upgrade of a failed system, cesspools, we believe, that are partially in groundwater. The property is for sale. It's under agreement with Minglewood Homes, where it's a project that's been permitted with conservation to tear down the house and build a new house. The septic system is being upgraded, as shown on the plan. It is as far away from the bordering vegetated wetland as we could possibly get it. It's on the vacant lot next door, right up against the street. We really have no other place to put it that would be further away. So we're here asking for a variance, for a local variance only, to the setback to the wetland. So I'll be happy to answer any questions.
Okay, thank you. I just had a couple quick ones to begin. Is the old cesspool on the plan, or is it not? There's a note here about it.
We don't know where it is.
Don't know where it is. Okay, and then my other question you already answered, and that's our usual question, is this new septic system as far away from the wetlands as you can make it?
Yes, we thought about getting a variance to the street, but the water main is on that side of the road, and we have to do an overdig because the unsuitable soil's there, and we would be definitely undermining the water main if we went any closer than the 10 feet we already are from the property line. So we are as far away from the wetlands as we can get.
Okay, thank you. Questions or comments from the board?
Judy, is it commonplace when there's a cesspool upgrade like this
that the remnants of the cesspool would normally be removed?
We usually ask that they fill them in, so I would ask that the contractor try and locate it when they're on the site and fill the cesspool in.
So it doesn't,
Yeah, so you wouldn't have any collapses in the future.
okay. But there's no real environmental imperative to have to dig it out or clean it?
Not environmental, no. Just
Okay.
more, I think more for safety purposes.
Okay, thank you.
Ron?
Judy, do we have any plans at all of this where the cesspool could possibly be?
No, we don't typically have cesspool locations in our files. Usually, we don't even, if they have a cesspool, often we don't even have a file for the house. So,
Okay, thank you.
Mr. Clark, has the
I
house been
think there's a note on the plan, for the contractor to locate, pump, and remove.
Mr. Clark, John Beckley, has the house been occupied recently or not?
It was occupied in the summer months, for the last couple of years, for 1 or 2 months. The current owners just finished building a house on Wilford Road, and they're there now. So this house has, I don't think it's occupied this summer, and it might have been occupied last summer for a couple of months.
Okay.
But
Well, what was going through my mind, I'm sure this is self-evident, if there's a chronic slow discharge of a failing cesspool, there might be evidence down on the back side of the property that could give clues as to where the breakout may be happening.
it didn't fail because of breakout. It failed because it categorically fails as being a cesspool.
Because it's being transferred.
right. So anytime
Yeah.
there's a transfer of property, they have to upgrade the septic. If it's a cesspool, they can't transfer with a cesspool.
Oh, I thought it was a failed cesspool,
No, we consider it a failed system.
because it is what it is.
Because it's a cesspool, yes.
Okay, okay.
So if it's been vacant this summer, chances are the cesspool's probably dry,
Yep, okay,
especially after this summer.
okay, yeah, right.
Okay, well, we have a recommendation from Judy to accept the variance as it is an upgrade from the cesspool, and it's in the farthest position it can be from the wetland. So can I get a motion
I'll make the motion to approve.
and a second?
I'll make the motion to second.
Okay.
Would you like me to read the?
Yeah, Judy can read the conditions, and then did you need to add removal of the cesspool? Or is that something you can handle otherwise?
I usually just put that on the permit.
Okay.
So, there's just 3 conditions. The applicant should restrict the property to a maximum of 3 bedrooms and record this restriction on the deed at the Barnstable County Registry of Deeds. The applicant shall submit a copy of the executed deed restriction to the board. The engineer shall submit an engineered as-built plan, including as-built elevations, with a written certification that the system has been installed in accordance with the approved plan. No alteration to the floor plan of the dwelling will be allowed without further review by the Board of Health or its agent.
Okay, can we get the vote?
Any,
Oh, we have,
any public comment? No, any public?
oh, yeah, and any public comments, please? Okay, hearing none, then we'll take a vote. We can probably take a voice vote, I think. All in favor, say aye.
Aye.
All opposed, say nay. Hearing none opposed, the variance is granted. So, Mr. Clark, you're all set.
Thank you very much. Have a good evening.
Good evening.
Okay, so the second item on the hearing is, it's on our agenda, bedroom definition, and this gets to the computation that you make with total number of bedrooms, total number of rooms getting to presumed bedrooms. But what I'll do is just to set this up is I'll read, Judy has sent to us from the Title V bedroom definition, And I believe this comes from the state regulations on Title V. So this is an existing state regulation, and Judy can correct me later. But the important thing is, and I'll read it, where the total number of rooms for single-family dwellings exceeds 8, not including bathrooms, hallways, unfinished cellars, unheated storage areas, the number of bedrooms presumed shall be calculated by dividing the total number of rooms by 2, then rounding down to the next lowest number. So I think this means if this presumed number of bedrooms comes in higher than the number allowed by the town, then it would be a plan that doesn't pass. That's my interpretation. But my first question for Judy is this part of the state regulations, so that it means that we as a board don't have to add it to our local regulations, but it already exists and we can just make note of it and agree to use it?
Yeah, this is in Title V for the definition of a bedroom for calculating design flow. My understanding is it's already in there. We can use it. We have chosen as a policy not to use it in the past, so it's something that we could use.
Has it been a policy, or we just haven't done it? I haven't done it in the time I've been on the board.
It's been a policy more than anything. We've always just gone by the straight count, so.
Okay, well, I'll open it up to the board, and then maybe we would have to take a vote on changing the policy, I guess, but.
So I want to make sure I understand this clearly. If the house has a lot of rooms, and you divide by 2, and then you add 1 or not?
No,
You
this
divide
is-
by 2, and it's a partial, you round down. So if that calculation was permitted more bedrooms,
Presumed to have more.
if it was if using that methodology
Yep.
arrived at, say, 6,
Yes.
but our regulations, based upon the size of the property and only allows 4, then we interpret that as being 4. Is that true?
Interpret as being 4,
We would interpret the number of bedrooms being proposed. We would interpret the number of bedrooms being proposed at the higher number.
We would allow the higher number.
no, I don't
We
think.
wouldn't necessarily allow it. We would
Which would
interpret
we
it.
follow? If we had two
So if they were asking, someone presented us a floor plan, say a 10-room house,
Yep.
and they're saying it's 4 bedrooms, and they were asking for 4 bedrooms, but we counted up all the rooms and felt that there were, based on the total number, we came to 5, because 10 divided by 2 is 5, then we would be saying, no, you have too many rooms.
Okay, so the result would then, the home would have to be downsized a little bit.
Right. And I think that's what the concern has been of the board over our last few discussions, the last few meetings we've had, and that's why we brought this back up. I think Dick wants to make a comment.
Yeah, go ahead, Dick.
Yeah, I think this basically will resolve a lot of the issues we've had over the last several months with plans coming in that show a house to have 4 bedrooms, but then also has an office, a sewing room, and a workout room with a double bath attached to it. And as long as they had a 5-foot cased opening, they could declare that those other rooms are not bedrooms. And as a result, then there are all these big houses that are being approved with septic systems that are really inadequate if those other rooms are ultimately going to be used as sleeping rooms. So this would resolve that problem. If we changed our definition, our bylaws, our rules to say that when a plan comes in, the number of bedrooms in that house is either the number of bedrooms shown on that plan or the number of bedrooms determined by the Title V calculations. So if a house has 11 rooms and they say it only has 4 bedrooms because a lot of those other rooms don't meet the definition of a bedroom, the 11-room house would, by definition, be a 5-bedroom house, because 11 divided by 2 is 5.5, you round down to 5. So that house couldn't be approved with a septic system for 4 bedrooms. And that would resolve a lot of these problems that we've had with houses where it appears that the house is being designed to sleep more people than the actual number of bedrooms shown on the plan. I would strongly recommend that we say that our rules for approving these variances count the number of bedrooms as the number of rooms on the plan defined as bedrooms, or the number defined by the Title V definition, total rooms divided by 2, rounded down, whichever number is lower.
Yeah, thanks.
You know, we saw a house not long ago that had an office that had a bathroom with a double vanity, a shower, and a bathtub. You know, which that house, you know, had more bedrooms, according to the Title V definition, than the plan identified as bedrooms, and so that house would not have passed. The variance wouldn't have been accepted because the number of bedrooms is too high for the septic system. And if we're trying to limit the number of the amount of nitrogen being deposited into the town, and you know, it's crazy to be approving houses on 1/3 of an acre that have 12 rooms, but say they only have 3 or 4 bedrooms.
Okay, good. Other, more comments from the board?
Thanks for that, Dick. I understand, I think, better than I did before.
Yeah, I basically agree with what Dick said, except I think that my understanding is this is part of the state Title V rules and regulations, in that for us to use this, we don't have to add it to our local Chatham bylaws or our local Chatham rules on bedrooms. That we can just
Change our
agree
interpretation.
tonight that we want to take it on as a policy, and that we will begin to take it into account and use it, and I think that has the full force that Dick was talking about.
I think
But the
that's.
problem is that we have been doing it a different way for the last several years, and we have in our policies a definition of number of bedrooms. And you know, if we then, you know, and if we say, okay, our policy says the definition of bedrooms is the number of bedrooms on the plan, and we don't count an office with a 5-foot cased opening as a bedroom, and then we say, but now we're saying it is a bedroom because we're using this Title V definition. I think it would be much clearer to the architects and the people that are submitting plans if we just simply added to our rules a statement that we're going to use as the number of bedrooms, either the number of bedrooms on the plan or the number of bedrooms calculated by the Title V rule, whichever is less. And then there would be no question about it.
Yeah, I think, I understand what you're saying. I think there's a big difference which way we go, because if we add it to our bylaw, then we go through that whole process with an open forum and public meetings and all that. There's a long process, so I'm not sure we have to do that. I'm not sure we have the expertise, but Judy, is there a way to answer that question, whether we need to go through the whole process or whether we can just say it already exists? I mean, there's lots of state
We
Title
just
V
endorse it?
rules that we don't have in our bylaws that we do follow.
Carol, did you want to say something?
I just was saying, it seems like this would be such a clear-cut answer to what we've been trying to work out, that if we would just endorse this and let them know this is what the Board of Health is doing, and all the contractors and architects would know that this is what's going to come down, and it's not going to change. It's like, we're not going to say, okay, you can do this, but you can't do this. This is the rule, and that's that.
Yeah,
Yeah,
I agree.
I mean, I did speak with Dr. Duncanson about it, and he agreed that we, because it's already in Title V, we can use it.
Adopt it by
The only thing we
reference?
can't do is use something that's less restrictive. So this wouldn't be less restrictive. I mean, our regs, you know what I'm saying? We couldn't do something that would be less restrictive, so we'd be okay. I would probably just run it by our town council, just to make sure, but,
And then
I don't see a
if we did what he would guide us to do, which is perhaps approve a motion to effective, with that date, interpret these regulations accordingly, then I would also say that Judy, that you should send something out, if we do this, to all the architects and the engineers, advising them that henceforth, the Board of Health will be determining
yeah.
the number of
Exactly.
bedrooms
I think that would be a
pursuant to
good
the-
idea.
So it's crystal clear, nobody comes in
Right.
and gets ambushed, 3 months later because they didn't know.
And if it's already approved by the state, it seems like it's something
It's
that
a
we
change
could
of policy
easily,
that they
right,
need to
put
know.
it as a policy for
Right.
us.
Well, I'd say, to bring up what Judy said, do we need an attorney opinion before we take a vote tonight?
Why would we
Could we just
need, I'm
proceed?
sorry, why would we need another attorney opinion when it's already written by the state? I have no idea.
I don't think we do, myself.
I mean, we can go ahead and I can send something out saying we're doing it and, at the same time, consult our attorney just in case
Yeah.
there's anything.
Yeah,
or
that makes sense.
Anybody challenges us, we can have the question out there, so.
And I agree, once we emphasize that we're going to use this policy, that by and large, this will get worked out before we even see a variance
Yes.
with Judy and the architects and all that.
Right.
So,
And we do have a meeting next week.
next week?
Oh, no, I'm
Oh,
sorry.
I think
We
it's-
don't, I'm sorry, you're right. Our next meeting we have 2 in a row, but not till after Labor Day, so we wouldn't have anything come up. I'd be able to definitely get an answer before then.
So could we,
So can we?
Do a motion
can I
tonight?
get a motion to, that we would like to change our policy and begin to use what is already in the Title V state rules, saying that the total number of rooms divided by 2 is the presumed number of bedrooms, and begin to take that into our calculations for variances. Ron?
It seems like it's a lot clearer and easier to follow than anything else. For once, the state has it spelled out pretty clearly with a formula how to do it. I think that's the best way to go.
Do we
I
need,
agree.
do we need to have a timeframe for implementation, or just go forward with it effective immediately?
I think
I think maybe a time frame. Give Judy a chance to check with the attorney and
September 1st?
get some information out, a notice out.
Yeah, I mean, it would be anything submitted to the next Board of Health meeting, which is until, I think, the 15th of September.
Okay,
So-
so we could do it September 1st if
We
we
can make
want.
it effective September 1st?
That gives a little time to shake down, make sure everything's good.
Edward? Dick?
One word of warning. When we do this, I predict we're going to be seeing a lot of open concept plans with giant rooms with kitchen facilities at one end, dining room in the middle, and living room at the end. And we're going to have to decide how many rooms that is. And that's not written anywhere. So I think, we're just, I don't think we want to think this is going to be really easy, because I think there's going to be the clever people are going to try to figure out how to get around this. And
I think that's
we
true in
need
any
to
case,
decide,
actually.
If there's a gigantic room and there's a stove at one end and a dining room table in the middle, and living room furniture at the other end, that's at least 2 rooms and probably 3.
But I don't
Well, we just have to
think those are
handle
the
it.
rooms that we're usually concerned about, so,
Right.
I mean,
Yeah, but you got to count the number of rooms in the house and divide by 2. And if they take
only
a
if it's
giant-
over 8, so only if you have more than 8 rooms do you use this total room up.
Oh, right, but
There's
the
always
thing
going to
is,
be
then
challenges,
they'll
but
be
at least we
able
could
to-
start with this.
In the audience?
Can you come up? can you go up to the mic and,
So we'll begin
Can you hear
input
me?
from the public now.
Sorry, I didn't even mean to come to speak about this, but I just have one question. Many of us did put in sewer, and we were allowed an extra bedroom as a result. Does that still hold?
well, of course, yes.
Okay.
Yes,
Just
unaffected.
Yeah, I think this would apply to variances coming before us when we
That
see
have septic.
a new plan, basically.
got it.
Okay, can I get a motion, or maybe there's more discussion or input from the public?
I don't see
I
any.
guess that comes after, but.
I think we can agree on what we just talked about.
Your button.
Oh, sorry. And looking over the precedents, I find it very helpful, and I think we have done a good job of getting something that's going to be a little bit more safe, I say, and I'm happy to vote for that.
Yep, and then I can sort of paraphrase the motion at the end, and you can correct me, but is there a second on it, Ed's? Ron will second it. And so I'll just kind
Can
of,
you repeat the motion? Can you repeat the motion?
I'll repeat the motion, that as a board, we agree to have a policy where we are going to use the existing Title V portion of its bedroom definition, which states that total number of rooms for single-family dwellings exceeds 8, not including bathrooms, hallways, unfinished cellars, and unheated storage areas. The number of bedrooms presumed shall be calculated by dividing the total number of rooms by 2, then rounding down to the next lower number. And then that means for us, if that presumed bedrooms comes higher than the bedrooms allotted by the existing town rules, then that plan wouldn't pass.
Right.
That's, is that, to the people who made the motion in the second agree?
Yeah.
Yeah.
Who seconded?
I do.
Ron?
I'm sorry,
So-
I'm trying to take notes here and contribute to the,
So I guess any input from the public,
I don't.
and then we can we'll take a roll call vote.
Did we have effective September 1st in that motion?
Oh, no, but we will make it effective September 1st.
Right.
And then a roll call vote in favor, I'll call Carol Boyce,
Approve.
John Beckley,
Approve?
Ed Sheehan,
Approve.
Ron Broman. Okay, then, and I approve, so so it passes.
Okay.
Okay. All right, now, third discussion, and it's termed rental bylaw. And we started this discussion at the last meeting, and I think this is it's kind of a big discussion. It may continue on for a while, but I'll just kind of set it up with where we were last time, and then we'll get the discussion going from the group. And basically, as Dick said, we struggle with looking at the number of bedrooms in a plan, and that number of bedrooms is kind of our way of determining the usage of the septic system. And because of two specific complaints kind of highlighted to us the problem. And one was a property that advertised that they had 9 bedrooms when they actually had 5. This is an internet advertisement as a rental, and that it sleeps 20. And then a second one was an internet advertisement as a rental, which advertised that they had 8 bedrooms when they actually had 4, but that it sleeps 22. Judy has the ability to correct the number of bedrooms, because that's already determined by the town, but we haven't really had a handle on the number of occupants. And so that brought up the issue of rental bylaws. We can talk about it. They're not uncommon on the Cape. A number of towns have rental bylaws, and a part of that rental bylaw is actually an occupancy rate determined by the town, and that would get at those two issues. Now, in reviewing this, in 2017, there was a residential bylaw working group formed. It had 2 members of the Select Board, 2 of the Health Board, the Health Agent, the Director of Health and Natural Services, and Katie Donovan. And they came up with a proposal. At that time, they were concerned mostly about water usage.
That's right.
That went to the Select Board. And the Select Board heard that, and I'm a little lengthy here, and I think the key thing is that the Select Board didn't turn it down. What they said was they referred the rental bylaw back to the Board of Health, Economic Development Advisory Committee, Water and Sewer Advisory Committee, and the Finance Committee for public hearings, and a return to the board for more discussion and consideration and to see if they would pass the bylaw. And then that kind of fizzled out and didn't go anywhere. So now it has come back on board. Our interest, I think, is the occupancy rate of rental dwellings as a way of monitoring how much the sewer systems are used. So I'll just open it up to whoever has a comment or a question. Ron?
Yes, I have a question. Is this come under our authority or the Select Board?
Well, it's a good question. I mean, I think that, I don't think there's a set answer, but I think in general, I would just say, this is a big town-wide issue. It's an important issue. To me, it would definitely have to be something that goes through the Select Board.
Yep.
So it's not something that we're going to make ourselves. We have an interest in having one, I think. So, and this is myself I'm speaking, I think that what we would do would be trying to bring this issue forward and back to the Select Board, hopefully for consideration, and give them a reason to, or an explanation as to why we need it and how it would help. And then there would be a process, which might be another working group. But the Select Board, I think, ultimately it would go to the town meeting.
Yep.
And probably pass as a bylaw. And, as I told Judy, if something like this rental bylaw came into effect at Chatham, it would require more town employees. It can't be handled by the health department.
Right.
Sometimes sometimes it's handled by the building department, I think. But it would require some money and some employees as well. So it's a big issue.
Do you think, I'm sorry.
Go ahead.
Do you think we could work with the 2017 draft and just get something down and start that as a working document, and then?
I think how we
Make it
proceed
better?
from here, I mean, that's open for discussion, whether it's, go ahead, Judy.
Yeah, I mean, the 2017 draft was, and I think John can agree that it was really
Different.
together based on water usage to
Yes.
try and
Right.
collect.
It's a different area of focus.
Yeah, different area of focus, trying to gather information.
Data
I did put in your packet what Orleans is doing, which I
Yes.
think is very good, very thorough.
Much closer
It's
to
been vetted by their council already. What I would recommend we do is, take that, make it maybe more specific to Chatham, and then once we come up with something that we are happy with, perhaps then send that back to the Select Board, kind of as an answer to what we never sent back on the 2017 one. We never reviewed that.
I think that's a good idea, you're saying.
That was a recommendation. Bob and I talked about it this week. We both agree that what Orleans has done is very good and
It
very
is.
similar to what our concerns are. So that's what I would recommend. Perhaps I could put something together before the next meeting. We could all discuss it again and then send it to the Select Board.
So what was?
Because if we get something together, we can get it on for next spring's town meeting.
Move it
It
forward.
would be possible to keep moving it forward.
Was Bob comfortable with the Board of Health putting this bylaw together as the working group did it last time.
Yeah.
It would just be us. I mean, I think one thing is it's going to require input from a lot of different entities in town to get support for it, but
Right.
I guess that could be
I think
handled by the
he-
select board.
I think he felt we should, send it to the select board, but maybe also send it to some of the other committees as well that would have concerns about it, economic development, community development department. So
Or
it definitely would have to make its round, and perhaps there would have to be some internal working group at some point. But if we could put something together as a jumping off point for the select board, I think that would be good.
And then we could put together a letter that included the other committees that were recommended at the last time by the select board to be involved, and start a process.
What we could do is prepare an initial draft of what we like, what we think would work
Yes.
for us, and then send that out to the other interested departments with the request that they review it and comment. And they will see things that perhaps we don't see,
Right.
right? And then, I agree, this Orleans document is excellent. It really is excellent, but it also leaves some open issues. And one of those that I find very compelling is whether there would be any appropriate role for the town to impose a limitation on the number of short-term rentals. I mean, that's a huge policy question.
It is.
Right, and I think that's something that they're struggling with as well.
That's why they didn't
They're
lay
not-
anything out, but
they
they
did not.
paved a way for them to consider that in the future. For instance, is there a public good associated with a town having a cap on the number of short-term rentals that could be allowed to be in a town? Is there an argument one could make to preserve the character of communities and neighborhoods so that you couldn't wash over all these? Suppose River Bay became 80% short-term rental. I mean, you're losing something there, right?
Yeah, I agree. It definitely is an issue for some people in a town.
Yeah.
Absolutely.
I think if we want to get a rental bylaw that gives us an occupancy rate, if we load on too many hot button
I agree.
issues, it
It'll
will stop.
sink.
Those may be things that get added on and get
Later.
reviewed and whatnot, and that would be a better approach. I think, Dick, you have a question or a comment?
Well, yeah, I think this year we're seeing something happening that really would be helped by limiting the number of short-term rentals, and that is that the town is running out of water. That we're hearing that in Harwich, the water pressure in their lines is too low. And there's a lot of discussion about why that is. But one of the reasons is that there are just too many people using too much water. And, people say, well, it's because the aquifer is too low. I don't really think that's really the reason. I think the reason is that we don't have storage capacity and we don't have enough wells and pumps to pump enough water to satisfy this very dramatic increase in water usage. And so limiting the number of people in town by limiting the number of rentals would likely help that problem, which is getting worse every year. The other issue with this is there's some difference from town to town in their ordinances. Some say that the occupancy limit is 2 persons per bedroom plus 2. In other towns say 2 persons per bedroom. So that's something we need to think about, that number.
Yep.
And then we would also, I think, like to include the same bedroom definition for rentals as we just discussed for plumbing, for variances, for septic systems. A house may say that they have 5 bedrooms now because they've been allowed to do that, and we need to limit the number of. We need to identify the actual number of bedrooms in these houses.
We would use what we have on file for septic to determine that, and if we don't have anything, then we would use that
Dick,
determination.
I would argue,
So even if we said that it's a 4-bedroom house for septic, and we know that there are 4 other rooms in that house that have bathrooms attached or whatever.
It would
that the
be limited
people that own
to
the houses
8
are
people.
Declaring as bedrooms, we wouldn't allow them to use
Right.
that definition.
Exactly.
Dick,
They would be limited by the septic.
Dick, I'm not sure I agree with your notion that more short-term rentals equal more water use. It's possible. We don't have that data. However, if as part of a bylaw, a new rental bylaw, we capped the number of occupants that would be allowed in all these rental units, that, I think, would go a long way towards assuring that a use of water in a short-term rental 3-bedroom house should not be any different from the use of water in a 3-bedroom owner-occupied house.
Right.
We would adjust that through the control of the occupancy limit, and that would be enforced through the inspections and the terms of the bylaw.
Yeah, I think that is part of the discussion if we put together this proposed bylaw. I think right now, I don't think we know, we don't know the number of rentals. It would only be until you put a bylaw in place and you force people to register that we would have an idea of how many rentals we have in the town right now.
Yes.
I'm assuming, so.
Excuse me.
According to the state, we have registered with the state for tax purposes, it's over 700.
Oh, registered for tax purposes, but
Right.
somebody can advertise online and rent it, and would we know about that?
No, I'm sure there's more than what are actually registered,
Yeah.
so.
But the state
one-
can tell us, right, the
Right.
rentals that.
Last time I
point,
checked,
right.
it was like
have to ask.
So
740.
let me understand this. So right now, today, if you are a homeowner who's renting your house, you're required to register that fact with the state of Massachusetts. And are you also, through that registration, required to pass to the state certain tax fees that you
Yes.
collect on top of the rent that you?
Well, it goes
Okay.
on your
And I
income.
think, and I have to clarify, I think the town is supposed to be getting, if they've elected, they get like a 3% of that or something.
So who does the property
to
owner
clarify that.
remit to, the state or to the town?
I think it's through the state directly. I can
Or does
confirm
one-
that
does
before the next
You do to one,
meeting.
and then the other one, that takes their cut, and then they pass the rest on, maybe.
Yeah.
Yeah, I was unaware of that.
Yeah.
So there is
That came out a few years ago at the state level.
not that long ago, right?
No, not that long
Yeah,
ago.
let me just say, okay, so most towns that have these bylaws, they charge a yearly fee, like around $100, and that is used to defray the cost of the extra personnel. I think there's one town that actually imposes an excise tax on those, but that's not common.
Okay.
But one other important thing, it goes back to Dick's point. I think it's two completely separate discussions, whether there's a rental bylaw that puts an occupancy limit and whether it's a private home that we're putting an occupancy limit on. Judy, do we know any other towns on the Cape that put an occupancy limit on private homes?
No, I
I don't
mean, we're
think so.
not.
I don't think so.
What we're talking
I
about
think-
for the definition of bedroom isn't really putting an occupancy limit
Right.
on it.
Right, so.
Rentals,
I
we
think-
would be doing that.
So
For rentals,
we're talking about
yes.
rentals. So I think that, if you own a residential property and you choose to turn it into a business and rent it, then there are some regulations.
There are
and That's
guardrails,
pretty fair and appropriate, I think. And all the towns are doing it, so that's pretty straightforward. I think, I agree with Dick's argument that it would be nice. I think it's a whole separate discussion if you're going to put an occupancy limit on a residential home when the grandkids come and you have guests. That's a whole, I think, my own opinion, if we wrap that into this rental bylaw discussion,
It's not going to work.
it won't work.
No, I think we should
don't think you'll
stick with the
get
rental.
Agreement on that. I know that the select board in the 2017 when this rental bylaw came up, and it was mostly about water, there was a hint in the discussion that they were concerned that this might turn into an occupancy limit. I think in 5 years, things have changed greatly in the town. We feel like an occupancy limit is good, at least my opinion. So, but Dick, go ahead.
Dick?
You know, my suggestion wasn't, I didn't want to imply that I wanted an occupancy limit on people's homes. But with regard to the water usage, I think that there's a very significant number of these houses that are in short-term rentals where the houses are owned by people who are not living on Cape Cod and who are, you know, the house would otherwise be vacant. There's a house next to me where people live in South Carolina. The family is here for 3 weeks a year. From Memorial Day until after Labor, till almost Columbus Day, the house is occupied by short-term renters. And so in that house, certainly there's a lot more water use than there would be if the family was leaving that house unoccupied. And I think a very large number of these short-term rentals are owned by people who wouldn't be occupying the house themselves if they weren't rented. So that I think it really is an effect on water usage. Unfortunately, I have to leave, but thank you.
Okay, so more discussion? Carol?
I think we should just.
Carol?
Just one more thing. Carol.
Oh, yeah.
I was just wondering if maybe we could all work on some comments, and as far as maybe ideas for, for the bylaw, and then send them to Judy, and she can put them all together or something, and see if it helps come up with a draft or anything.
Yeah, I think-
Sure, I mean, I
There are
was planning on
suggestions?
using Orleans as a template.
Exactly, using
If you,
Orleans.
definitely, if you individually want to send me any thoughts based on what you're seeing
I
in
think
there.
we-
Using the Orleans as a document.
That's what I would
to
do.
go off of.
I'd start with the Orleans as the starting point.
Yep.
And then write edits,
Right.
questions, comments in
Right.
the margin,
And that way you get everything. So
and then
you
you
know.
could compile all those ideas
Yep,
into something that reflects all of our thoughts.
yep.
Carol Boyce.
I think we should just focus on the short-term rentals and use Orleans draft
Yeah.
as our.
Okay, I think we're coming to a, Ron?
I've got one comment. Judy, you mentioned that there's some 700 rentals in this town?
Yeah. Properties.
That we
Based
know
on
of.
what I saw
How
at
many
the,
residents are there in this home, resident town, houses?
how many,
3,000.
something like that, yeah. I mean, our year-round population is 6,000.
So we don't know how
Something.
many residential buildings there are.
I can't give you an exact number.
I have a question. I read something, it could have been in the press accounts or it could have been somewhere else, that what's reportedly happening is in some of these homes that are rented through these agencies, the home is not rented as a home. It's rented as individual bedrooms on a daily basis. So that you could have a 5-bedroom home. And bedroom 1 is rented tonight and tomorrow night by Airbnb, and it's rented Thursday, Wednesday, the next 4 days by somebody else. And then you've got people coming and going from the driveway, walking into their bedroom, not their rental house, their bedroom that they rent. And I just want to know, A, is this really happening? And B, how do we address that in what we prepare?
Some of that may have been covered in the Orleans. I haven't looked at that
I
closely.
read it in an article.
I
There's been
think-
2 articles in the,
There is a company that leases property from homeowners in Chatham. I have a relative who owns a home in Chatham. He signed a lease with a company. They've leased it from April 1st to December 31st. They pay him a monthly fee for that rental. They rent it out to whoever they want, how many people they want. They do nightly rentals, weekend rentals. They're running it like a hotel.
Where
They take care
each
of the
bedroom is
cleaning.
separately rented.
They take care of cleaning and all the maintenance,
That would be kind of like an Airbnb model for some,
and the homeowner
Individual.
has no say. They have agreed to lease it to them.
For a fixed fee, and then the rental gets what? Gets rewarded for pushing through as many short-term rentals in
I
the,
think these are things that we could control with a rental bylaw.
well, that's what I wanted to hear.
I mean,
In other words,
you could limit, you could say this would be only for stays of 60 days or less, or 90 days or less, because we don't want to stagnate our year-round rentals either, so this
No,
would
this
just
is
be
not a
short-term.
year-round rental. This is strict.
I don't know how you would control the individual room rentals. I mean, people have been doing that for
Well, yeah,
forever.
let me say, just to bring it back, I think as the Board of Health, I think our interest is in the occupancy limit, because
Right.
that is telling us how much the septic systems are being used.
Right.
The rental bylaw addresses other issues that are wider than us and may not be our primary focus. They may be coming from these other committees on the select board, so those are good points.
I would say the septic plus the water use.
Plus, yeah, but
would be
our primary interest out of this rental bylaw, to me, is getting an occupancy limit on the rental.
Here-
The
no,
other things will all come into this. Let me just say something else. I think that there's a business interest, because there are companies that are rental managers, that's all they do, and they have a big interest in something like this, and they've been very vocal in Orleans. So they will become involved. The other thing is that, the other thing that we'll have to discuss, and I'm sure, I'm guessing there'll be a difference of opinion, and that is how you calculate occupancy rate. In some of these towns, they don't really publicize it, and other towns, they tell you exactly how it is. In Harwich, it's, for a rental, it's 2 persons per bedroom, 4 bedrooms, 8 people. In Orleans, they're aiming towards, I think, 2 per bedroom plus 2. So that it's done different ways, and there'd be a difference of opinion. Myself, I think if you're turning your residence into a business, you come under regulation, and I would sort of err to the stricter side, and I think that protects the neighborhood some. But that will be a difference of opinion, I think, among everybody. Perhaps.
Judy, what percentage of households in Chatham are on septic versus public sewer?
I just asked Bob that question. I think it's about, right now, about 80% are on septic.
Okay. And what we're talking about.
Hopefully
here-
that's going down.
Slowly.
Yeah.
What we're talking about here would apply irrespective of whether it's a sewered home
Yes.
or a
Yeah, it
septic.
would make no difference.
Right.
Okay.
We have some comments from people in the audience? Are we ready
Yeah,
for that?
well, let me, any other comments on the board here? Okay, I guess public comments, we can take.
Elaine, I see your hand up.
Yes, thank you. First of all, in terms of water usage, I would disagree. There's no question that these summer rentals are making a huge impact, and I would suggest more than irrigation, because of the very thing you were talking about. We have a year-round population of 6,000 people, not residences, because many of the buildings in our town are businesses, et cetera. And in the winter, we only have about 3,500 full-time residents that stay here. In the summer, our population, it's hard to predict, but there are times it's 35,000. So they're having a dramatic impact, and you can just imagine if you've got 20 people in a house that's technically 3 or 4 bedrooms, taking 2 showers a day because they're going to the beach, it's a significant impact. Right now, one of the first things that we could do that we have not done, and we have been reluctant to do, and I don't know why, is the state does have a list of all those 700 rental properties. Normally, they have to register if they're going through a broker, a real estate broker, or Airbnb and those kinds of things. Those firms are supposed to, they're mandated to register with the state and collect those monies and send the monies to the state. Right now, I believe it's 4% that comes to the town out of however much, I don't know what their rate is, 10, 12%. We have the ability to, number one, increase that to 6%, which we haven't done, which I think would be a good thing to bring more revenue in. But more importantly, we've never asked the state for the list of those 700 addresses. That's been a problem because you have people who have neighbors who are doing this, and it's up to the people to have to complain and say, there are 20 people in this house. I have a neighbor that there were 12 cars in the driveway, in a small driveway, all summer long. There had to be 20 people in a 4,000 square foot home. And so I think there are different pieces to this. The Board of Health has the water quality concern and the water usage concern. There's a traffic issue, there's a parking issue. There are limitations on our infrastructure that are being impacted by those numbers. These are non-resident, 700-plus homes that are being run as businesses. They're investment properties that people rarely come in. And quality of life for Chatham. And we've seen it getting worse and worse. I think COVID really spurred it on and made it worse, and I think it's going to continue. So I would ask that you recommend that the Board of Selectmen, request from the state the actual list of properties. Then you know who they are. And then you can look at those properties and see how many bedrooms there are. And then if you find out that there's 20 people in a 3-bedroom house, you've got an occupancy problem. And I think some things could probably be done by regulation and some could be done by bylaws. But I think you're on the absolute right track. This is not going to get any better. It's going to get worse. And I think our water situation is being primarily driven by the massive, massive increase in the summer population. We can see it. We can't even move in town. There's no parking. It's very, very difficult. And so I'm very pleased that you're taking this on. And I hope we can get that list, because I don't think it should fall to residents to have to complain about neighbors unless it's a serious problem. It should be monitored by the town. Thank you.
Thank you, Elaine. Other comments from the public? Okay, and then if no other board members have comments, can I get a motion to begin work on a rental bylaw proposal that we would review at the next meeting and send on to the select board and the other boards who are supposed to be involved. That is the Economic Development Advisory Committee, Water and Sewer Advisory Committee, and the Finance Committee, who all have an interest. And the Water and Sewer Advisory Committee has been kind of dormant, but I know they have new members and they're going to start up again, so they'll probably have a real interest in this. Carol, Gordon.
Could we also work on getting that list from the state with the addresses and, I think they can probably just print it out and send it to us, can't they?
Electronically, they could
Do
send it
that?
to us with
Yeah,
one
I
button.
think I've gotten the number. I'm not sure if the names and addresses are listed. I
Maybe
can.
we can.
The button.
I've looked at it before, so I can see
get
if
that
that's
as well.
possible. The problem is that it, without some type of a rental bylaw and staffing, there's no way I can follow up or any of our,
Oh, right.
which is the whole point of doing this whole exercise, so that
Well,
we
this
can.
is a
somewhere.
document
Right.
that
we
would
have
help
the
us
document
with
to
our
work with
pursuit.
anyway, so
Certainly, yes, I
that would
definitely
be
can do
great.
that.
Thank you.
And I would emphasize again that this thing would require more personnel to take care of it. It can't all be done by the current health department. So anybody care to, mine was a suggestion, make a
Do we
motion.
need a motion to do this, or can we just have concurrence that?
I don't think we necessarily need a motion. I think
Okay,
we
so
can
then
just move forward with
we
this.
can agree, then
we
everyone agree with
discussed.
Continue it at the next
how I
meeting.
paraphrased it and suggested that we move forward?
And Judy, I would also request that you stay in touch with Orleans so that we have available to us the latest version that they are developing, because I'm sure over time, they're going to be tweaking their draft, and we want to stay as close to seeing what they're doing,
Okay,
because they're doing a lot of the legwork that we would otherwise.
yep.
I would remind the board members that Orleans is quite detailed. They put a lot of time into it. Harwich has one in existence, which is in comparison, very simple and straightforward. And so there's two ways to go there.
Is your-
Okay, so I think we finished this. We'll, Judy and Dr. Duncanson will begin to work on it. Ron?
I just want to bring up one thing, that I had copies of the town of Dennis regulations for housing amendment, the town of Nantucket, the town of Yarmouth, the town of Providence, and Barnstable also have plans.
For rental bylaws.
Some of those
Yeah.
aren't short-term, though. They're rental, like
Yeah.
Dennis is a
I just went
all
through
rental.
it.
Yeah.
But I,
Must have got these when we did
I
this
couldn't
before.
find a town that didn't have one.
Yeah.
Orleans is making one, Harwich has one, Falmouth, Dennis,
Barnstable.
Tisbury, Barnstable.
before I lose this thought, Judy, there has to be a line somewhere that you cross, that you've become a hotel or an inn rather than a short-term rental. And I'm getting to this idea as you've got a four-bedroom house, and now you're basically running it as a four-bedroom inn, where you're renting one night. You can rent Saturday night, you can rent bedroom number 2 Friday night,
It's usually Airbnb.
like an Airbnb. But an Airbnb,
They pay excise tax.
I don't know how developed Airbnbs are. Do they currently have 5-bedroom homes where they rent every bedroom? Do they?
Yeah, there's Airbnb.
But somewhere out there,
You can't really regulate Airbnb. I mean, that's not up to us. It's not up to us to regulate Airbnb,
but,
I don't
but
think.
we have requirements in the state of Massachusetts that define a motel.
Right.
It defines a hotel. Maybe rooming house.
Yep,
In New Jersey, we used to have all those regulations.
Yep.
And they'd all have little definitions. And I think we need to kind of cross-check those with what we have heard is happening in some of our neighborhoods.
That you think, okay.
Yeah, and I think Judy could look into that. I think there exist rules about what is a motel, hotel, a boarding house, and they come under separate rules, and I think they pay an excise tax in most towns in addition, and there's affordable housing taxes and all that.
Because-
So I think that's worked out, but that's something to look in preparation for the next meeting.
Right, because one of the things I read was, there was a woman or a person being quoted as saying, they were doing this so intensely in my neighborhood that it was like living next to a motel or hotel. Cars coming and going, people coming in carrying luggages in and out. And I would like to find a way to separate those two,
yeah.
right? So that we don't have that enabled in our new post-bylaw, rental bylaw.
Yeah, I think that's good. The rental bylaws also include parking regulations, where you can park a car, even
I like
numbers. So
that.
that all is to be worked out. So, but I think we've done enough to get things rolling, and then the next meeting, we'll have another, good discussion and sort of try to move the ball forward, put together a packet that really has some impact on getting this done, because we're actually an outlier now among the towns.
So-
Okay, any other discussion, or can we move on?
Would you like us just to work on as a working draft, the Orleans and the Harwich rental bylaws?
I'd start
Use
with.
those two
I
and-
think the
Just-
Orleans.
just
is much
Orleans.
more-
Just Orleans?
Yeah.
Okay.
The other
Can
one's
we get
so-
another copy of that, please?
Did you get a copy? Oh, yeah, you have them, don't you?
I thought,
I don't have any extras.
that's okay.
Do you want hard copies, or I emailed them
Email
to
it to
you?
me, that's fine.
I thought they were all emailed.
I thought so too, but I can't seem to
That's it,
find it.
yep, yep,
Not packet.
yes.
I'm also,
That's it in the
go-
packet?
And I eat out the Harwich one, I
Thank you.
think, as a separate email to all the members.
yeah. I'm going to give this clipping that I found very interesting to Judy to include to all board members. This is a letter to the editor, I suppose, written by a Delmore Vacation, right? And it's an interesting perspective of how they see what they do and the value they bring, the value added they bring to the economics. But I think they make some interesting points of how they, as a property management company, require that all of their renters sign agreements and are clearly given copies of what the rules are and what the rules aren't, and how they commit to having a resident manager nearby and can respond within 30 minutes of any complaints. But I mean, they lay out at least a vision that they feel they're
In
following.
that article, did they put down their estimate of occupancy per bedroom?
No.
Okay.
No, but-
That company is based in Orleans. They think that's their home. So
Yes.
they have a particular interest in what Orleans is, and they've been involved in discussions right along.
Yeah, but I'm going to give this
Okay,
to
good.
Judy so that she can, I think it's good reading.
All right, so I think that's a good start. That's more than I thought we might get to tonight. Any more, or should we move on to the next item? Okay, well, let's move on to an easy one. We're going to get an update discussion on the Mill Hill John McGrath property from Judy, I think.
Okay, so I spoke with a strike force team member from DEP, who last meeting I told you I had reached out to. We finally connected last week. He will be in Chatham on Wednesday to take a look at the property. I've made arrangements for myself, a representative from the fire department, the police department, and I talked to Noble about attending as well. We didn't want to have the whole Board of Health there because we would have to publicize it as a public meeting, and we don't want to, this is just going to be a start where he will come and assess the property. He's looking for hazardous materials. That's his only concern at the DEP level is hazardous materials. So they'll give us their opinion, and I was hoping maybe John could attend as well, since he's kind of initiated this and has some experience as well with these types of things in his previous career as a health agent.
And we would walk the property.
We would walk the property. Mr. McGrath has been notified that we're coming.
And we
Wednesday at 10 o'clock.
this
That's
Wednesday.
fine with me. And we'll have a police officer there to assure
Yes.
everything is.
Yes, I
Yeah.
spoke with the police department, and Mr. McGrath has been notified that we are coming on Wednesday.
Now, I would just add, this is information gathering in preparation for what we had talked about before would be an inspection that would be open to any member of the committee that wants to be a part of it, that would be scheduled later with the same police and fire. And then we would have more information, and we don't know where this is going to go, what'll happen, but this is a preliminary inspection. It's not the inspection that's going to lead
Right.
to phase 2. I just want to make that clear for everybody. Everyone will have the opportunity to walk if they like at another time.
Yeah.
When will you
Questions for
get your
Judy?
findings?
I mean, we'll
I'll be on
talk
the
to him that
spot.
day. I'm sure it's just going to be a matter of discussion with the rep from DEP.
Will he make a report usually, or we just take notes?
I'll take notes. I'm not sure whether he will put anything in writing or not.
I think they generally do.
Yep.
When they do a field assessment, I
Yeah.
think they'll generally capture that.
I think he would, yeah, I agree. I mean, he's making
the-
a formal, coming here
Yeah.
as part of his
Okay,
job,
good,
so.
good.
Because it'll be a good start, because we have, as a board, we have no idea what's really on the rest of the property. We don't know what we're dealing with.
None of
yet.
us
But
have
this'll
been
be a
down the
start.
hill.
Exactly.
None of us have been down
Preparation for the inspection where the whole board will be invited to come if they want.
It's a good document to
Posted
have, really.
And he'll have a trained eye that we don't have
Right.
because of the realm in which he works.
Right.
He does this all day, every day. And so he'll have a way to look and inspect and see evidence of things that we might very well miss.
Thank you, that's good.
So that's the update on that. That's where we are. I have not got an update on whether they're going to put, I asked Tom Temple to put have the signs, the no parking signs continued as they're supposed to be. I haven't heard back as to when that's going to occur yet.
Is the roadway remaining clear now?
Yeah, last time I was up there,
Good.
yep.
Well, I think there's an issue sometimes of parking,
His truck.
his truck. There's a spot where he parks, which maybe is no parking. There is one spot that is technically the driveway, but he has a trailer there. But that's really a police matter now about no
Yeah.
parking. Who I guess is Andy Goddard's been handling that? Is that
I'm not sure.
not sure.
Yeah.
So we could follow up with them, maybe just a
Sure.
quick call for the police and make sure they are checking the parking. Okay, other comments or questions about the McGrath? Okay. And then we have number 5, update of the Chatham water quality that Judy will handle as well.
Yep. So the last time we met, actually, we had a request from someone, one of our citizens, to an update on what's going on with the PFAS study. I did talk to Bob. As of now, they have not chosen a consultant, so that's still kind of pending. He's trying to get together with DPW to get that going, but it hasn't happened yet. Wells 10 and 11, which are the new wells, they've hired a contractor, Robert Hour's going to be constructing the pumps building, et cetera, so that's getting going. They're going to be working on the treatment, finishing up the treatment facility up there, and they've had, beginning meetings on all of that, and should start this fall and completed by September 2023. So that's for the new wells, number 10 and 11.
Is this the building that's going to house the treatment equipment?
It's the new wells themselves, the pump stations. The treatment building is, for 5 and 8, is,
Okay,
they're working on that as well.
okay.
The temporary treatment is in, what did he tell me? Let's see.
I get these all confused.
I know, it is. It's, right now, at well number 5, they have temporary treatment going, and they're working on getting that
I
treatment
thought those
building.
metal stainless steel containers were being put in a building.
Right, they haven't built the building yet,
They
so
haven't
that's what
built
they're working on.
Okay.
They're working on the design plans for that, and that's all I can say about that. Number 8 right now is offline. Number 5 is being used with the treatment. There's been no detected
Good.
PFAS.
And
Bob has been updating you with the results when they come in.
In a nutshell, how are we doing this summer with water demand?
I mean, we, as you know, we're in a severe drought, and we have issued no irrigation rules that were put out this week. So that's for town, people connected to town property, to town well. We are asking that people on their private wells also limit their watering or not water, but that's really a voluntary thing because we can't control people with their own private wells. As far as usage, I mean, I can't really speak.
Okay.
I don't have that kind of information.
The impression, my memory tells me I saw something from Bob not that long ago that was kind of tracking how many millions of gallons of water are being, and I think we were okay at that
Yeah,
time.
my understanding is that we haven't really had to turn on a lot of extra water supply. We're still running them partially, the wells, and
But I think I read on the town website the new drought restrictions, and they do say no irrigation of lawns. But I did not see parentheses, for, whether it's groundwater wells or, I didn't see a distinction there.
I think it was
says-
no use of automatic irrigation system. You can hand water.
Yeah, that's what I read, but I didn't see the difference
I
between
think
them.
what we've said before is that I guess the town doesn't have authority over private wells, but they are asking people with private wells to follow the same rules.
But I didn't see that.
It was at the
It was-
bottom of the.
Was it at the bottom?
Yeah.
Okay.
yeah,
Yeah, and
they
they
recommend it.
they sent it out.
It doesn't, it's not
Doesn't have
clearly
the-
stated.
And they were doing robocalls too, actually.
There was a
I
robocall that
just-
went out today.
I
Right.
think it was at the bottom, though.
Okay.
It's implied that everyone should do it, and then they technically, at the bottom, they said, well, we're asking people with wells to do it. And when I think most people are.
Yeah, as far as the usage of water, he did say that well number 4 is offline, but as needed, it does come on, but I don't think that's been
We're not doing it now.
overused.
Okay,
No.
good.
That's all pretty much the same as the last time for all that. Well, things are moving forward. That's all I have on that.
Okay.
Any questions anywhere? Oh, Gloria's got her hand up.
Yeah, comments from the public on the McGrath or water quality?
Yes, thank you. It's Gloria Freeman. Before you discount the town regulating private wells, I'll send you a copy of an email I received from DEP in which it stated that local boards, and I'm quoting, local boards of health are the regulatory agency for private wells, and unless the specific community has passed a bylaw or regulation to control private well use, the conservation measures that were discussed in their latest press release are not enforceable. But that indicates to me, and I confirmed it today by phone, that specific communities do have bylaws or regulations to control private wells in an emergency. And while we are not in a severe drought, we are in a significant drought, and we probably would not want to enforce or prohibit private wells from being used for irrigation or watering. It is something that we can consider so that the law is, or the regulations are equitable and fair for people who are on municipal water and people who are on private wells. And I'll send you a copy of this. I'll also, of course, copy Judy and Dr. Duncanson. Thank you.
Thank you.
Thank you.
We do have private well regulations. They're quite old and probably do need to be updated, so.
But that's a good point.
I'm not
I
sure
never
they-
thought about that, but that's good that she shared that with us.
Yeah, we can definitely take a look at that.
Okay, let's, Carol.
Okay. I have just a couple things I wanted to get into the meeting, so maybe we can think about. First of all, maybe an update on the cleanup of the airport, how that's going along with the fishermen moving their things and how that's getting cleaned up there. And also, it came to my attention about how perhaps we should start becoming more concerned, like we are with the water quality, with the air quality as well. Someone had emailed me that they were walking on Harold Lane or Harold Road with their grandson, and the plane came over so low it barely almost hit the trees, and that the fumes from the fuel were just overbearing. And it seems that particularly people on the flight path, they're finding that with the more planes coming out of the airport, there's more fuel, there's more fumes, and it's hard for them to even be on their decks now having conversations and when the plane's going over so frequently. So it's almost like we can't control the airport, we can't control the planes, but we could do something maybe to impress upon them the quality of the air that's happening now with the increase in flights. Just wanted to put that out there. That could be something that maybe we talk about, as well as with the water quality.
Electric planes.
Pardon me?
Electric planes.
There we go.
Will solve
Okay.
that problem, right?
But,
Okay, thank you.
so I'd like us to consider that, please.
Judy, did you have a COVID update?
Oh, we have.
I do, yep.
All right, with the last item 6, the COVID update we'll cover.
Yes.
So to date, this month, we've had 14 cases. In July, we had a total of 53 cases. Those are confirmed cases. Our positivity rate has been going down the last several weeks, and it's at 9.43, down from 12.87 last week, which is, I think, good news. And our incidence rate is also going down. It's at 16.2, and that's the number of new cases per 100,000 population. The county incidence rate right now is 17.7, so we're a little below that, and we're slightly above the county's positivity rate, which is at 8.78. So things are pretty much status. But the bigger news is today is that CDC did update their COVID-19 guidelines for those people who are exposed or have COVID. So as of today, what they put out, and DPH forwarded it to us at the town level as well, regardless of your vaccination status, if you have been exposed to someone with an active COVID-19 case, you do not need to quarantine. They do recommend that you wear a high-quality mask for 10 days and test on day 5 or after. So basically, you're going to monitor your own health and wear a mask. If you're positive, you If you're positive for COVID-19, the same as pretty much as it has been, so you're going to isolate for 5 days, and if you're symptomless, or your symptoms have subsided, you can test on the 6th day and be out of isolation after that, and then continue to mask for 5 more days. And they've also updated their school policies for this coming fall. They're not going to be tracking, I don't think, COVID cases in schools unless there's big outbreaks, and pretty much the same guidance for cases.
So they probably won't be doing that pool testing they had been doing over at
I think they're leaving it up to the individual schools, so I haven't
okay.
heard anything about what's going on with Monomoy, but it looks like it's kind of just going to be, I think that what they feel is that, or what the state feels and the CDC is that we've got to the point where people are living with COVID, they're not, a large percentage of people are vaccinated, and cases tend to be milder, and it's just,
Well, we're sliding into the endemic phase.
Right.
If we are not already there.
Exactly.
What we have to accept is going to be a bouncing around of sporadic cases ongoing,
right,
and then that's not going to go away.
exactly. So that's where we're at.
Judy, one question about if you come down with COVID. The guidelines don't say you have to test negative to come out of it, I believe, right?
Right,
It's
no.
all empirical, it's by days and symptoms.
Right,
And if you can test negative, you can, move out of it. But you
But you
don't
still have
have
to
to test
isolate for
negative in
5
order to get
days.
it, to move out of the protocol, because some people don't become negative for weeks or months even.
right. You can still test positive.
Question from the audience or comment?
Yes, Elaine Gibbs?
Elaine could go first.
Oh, we have,
Can you hear?
what's your name at the podium?
Good afternoon, ladies and gentlemen. I am Ann Timpson, a Chatham resident, and I'm here to report a rather surprising and worrisome discovery I made this past Friday. A family member had major surgery this past week, and our Cape Cod Hospital case manager ordered a nurse from the VNA to visit as part of post-op care. When she arrived, I asked her if she had tested for COVID recently. She said no, and agreed to take one of the test kits that the Department of Health and Human Services provides at the annex. Fortunately, I had a test available, and she did agree to take it, but she said all that the VNA required were vaccinations. However, to expose a vulnerable post-surgery patient to even the possibility of the COVID virus is irresponsible and irrational when testing could solve this issue instantly. I was very surprised to learn that VNA does not have any mandate or regulations requiring periodic testing. Nurses are only required to have vaccinations. The nurse that came to our home thanked me profusely for offering a test. Since the state has provided the town of Chatham and other Cape towns with free testing equipment, I recommend that you as a board take action to ensure that VNA nurses visiting anyone in Chatham, whether private homes or nursing facilities, pre-test for the COVID virus. It has been a great help for so many citizens to access the free COVID testing equipment at the annex, and has helped everyone to quarantine more quickly and prevent inadvertently passing on the infection. We are all grateful for this opportunity to protect ourselves and others around us. However, unless visiting nurses also have that safety precaution, we defeat the success of this excellent program. Thank you for listening. I just one other quick comment. I think that what the state comes up with in terms of our numbers weekly might be a small percentage
Yeah.
of what's really happening in Chatham. And yes, definitely the virus, I've had B5. It hits you hard for 5 days if you're in your 70s, but you get over it and you come back relatively quickly. But I do think that a nurse coming to take care of someone who's only been out of the hospital a couple days with no testing it's just adding more problems. And there might be a lot of people in that house that she's visiting, so. Anyway, thank you. I've enjoyed listening to your whole meeting. You're doing wonderful work, and I appreciate all that you're doing.
Thank you. Can I ask a question?
Sure.
Does the nurse that visits the home, does she wear a mask?
Only if you request it. And it's the same with the physical therapy individuals. Only if you request it. I mean, we wore masks, and they were willing to wear a mask. The PT rep wasn't willing to take the test. The VNA nurse was willing to.
But I think healthcare settings still wear masks.
Yes.
And you can't go into a private doctor's office
Without a mask.
without a mask on.
That's true.
Is a private home a healthcare setting? I guess that would be.
That's a good question.
But I don't think we know the VNA rule. Maybe Judy can you just check the VNA rules?
Why they're not having
Well,
routine tests.
you know,
Her job.
I don't want to, I was grateful that they came. I mean, I'm in
You
a
know,
position with a family member who's had major spinal surgery and can't do anything right now. So the last thing I want to do is rub somebody the wrong way. But I felt that maybe this board
You could anonymously
use this
carry your
information.
question.
It's-
You
no,
have
it's
much more
possible.
pull than I do.
Yeah.
Is it possible for us just to write a letter suggesting it,
let's-
or
Is
is that in our
numerous
place to
being-
do?
I
or-
think we need to find out maybe from Judy what their rules
Yeah,
actually are.
Right.
let Judy,
I think if-
under the radar, call them and say that she heard this concern expressed by a resident and
Right. What
question
what
what
can we do
is
to
their
make it easier?
policy.
There's numerous VNAs that come to Chatham. You would have to.
Do you know if this was Cape Cod Healthcare VNA?
She was the case manager at Cape Cod Hospital, Anita, who was our case manager, set it up for us. But that
Would
doesn't.
that go through our,
Who is
we
the
have a
actual
contract, though.
VNA they're coming?
Pardon
Where
me?
are they coming from?
VNA.
Is it the Cape Cod Hospital VNA?
It's a great overall policy question, though. Do
Well, they
VNAs?
give you a choice. You can pick several different companies, and we picked VNA. And so my impression was that it was that they lived on Cape Cod, and the PT guy was from Harwich. I don't know where the nurse came from. But
I
it
mean,
was
I have
through the
contacts with the VNA of
We have a
Cape Cod
contract
Healthcare.
with one VNA.
We do, and I can check what their policies are. It doesn't surprise me that they're not required to test because they're going, the nurses in the hospitals probably don't test every day either.
No, not daily, but they are.
Weekly?
Nursing homes are required, the staff are required to
How
test,
frequently?
like weekly.
Weekly, yeah. Yeah, I know the
It
nursing
wouldn't be
homes
much of
do
a
that.
burden on a VNA to
Well, I
have
think
all
what
the-
what Ann's suggesting, though, would mean that those people would test every single day, even if they're asymptomatic.
Or
And that test wouldn't
once a
actually
week.
necessarily even pick up somebody who's just contracting the disease
Right.
and would be carrying it.
But
So
it-
it gets to be kind of nuanced there. But I think
Yeah.
a start would be for Judy to contact the Cape Cod Healthcare
See what-
VNA and just get what their basic guidelines are to
And why,
start the
and
discussion.
why? And what are their policies, and what's that based on? What's
And
the
whether they would agree if, Chatham citizens can go and get those tests, and they're available upstairs. So even if it came to the point where the VNA says, well, we can't afford to have everybody testing every day, at least if we as the caregivers could have the tests, and all VNA would then do is mandate that if somebody came into your house, you had the right to ask them.
If they'd have to sit there at the kitchen
Take
table
a
for
test.
15
I mean,
minutes.
that's what we did.
to
It takes
test, right?
15
They'll
minutes.
sit in their car for 15 minutes and then show you the
And then
negative.
show you the negative. That probably
Anyway.
makes more sense.
I
Thank you
can find
for
out what their policies are
helping.
and what the reasoning
Thank you
is
for bringing
behind
it to our
Thank you.
attention.
And then,
Thanks.
other public input, was that Elaine on the line?
Yeah.
Yes, thank you. I apologize. I didn't know someone was coming to the podium. To get back to the water ban, there's a couple things. One is that it sort of slipped through the cracks here because the Board of Selectmen had been given data that, only about 1,350 residents have registered their irrigation systems with the town. We know that there are probably another 2,000, and that they were required to do that. by the end of this last year. Actually, it was supposed to be the year before, but because of COVID, they had to do it. Only 450 put in the meters that they were required to do if they had an irrigation system. So 3/4 of the people who are registered have not complied. So everything that's occurred here in terms of, people that are in the database are the ones that are paying increased costs because they put in a meter. If you didn't put in a meter, you had to put in a well, so we incurred those costs, and now there's a question, well, you may not be able to use that either. My understanding was they were supposed to come down pretty hard on those 800 plus people who have simply not registered their irrigation systems and or put in a meter. So instead of writing them a letter, because we should have that information, you just cross-reference those people who have put in a meter against the other ones, and then to find a way of determining who the remaining thousands are that have irrigation systems. One of my understanding is that you can that the town can get overnight reports by residents of massive increases of water usage during the night. That would indicate to me that those are the unregistered people who have irrigation systems. Instead, they just developed a survey that they're putting it out for RFP, and the survey probably won't go out until, I don't know, another month, asking people to please tell them if they're not registered. And it's voluntary. Nobody is going to tell them if they're not registered. So if we're really serious about making sure that we know what the universe is here as to where our water's going, by whom, there has to be something stronger than a voluntary survey saying, gee, can you tell us if you've broken the law for the last 2 years? I just think that, the bureaucracy of this whole thing is taking so long. And, if it's a serious problem and we're going to run out of water because it's going to be another 2 years before we get wells 10 and 11 up, we still can't use 8. And forget the idea of building new wells, which we need desperately. That's going to take another 5-7 years and probably $100 million. We've got to, I hope the board, that the select board would get a little tougher on identifying who all these people are. It's been a punitive system that the people who have followed the rules are the ones that are paying the increased rates.
Right.
And have gone to great expense to comply. And so that's all I have. One other thing is, I think there's a few problems with the new ban. It says core businesses whose water is a core part of their business can still water all the time, I guess. And they said like nurseries, but I guess I'd like to know, what other core businesses can developers say, well, it's part of my core business to put in landscaping on a new house, or Eagle Wash, that we're going to come and power wash the whole house because they have to use water. So I think that could use a little work. And the only other thing I have is, to say that you can hand water between 12 a.m. and 7 a.m. With the coyotes. I mean, if they had extended it, 5 to 10 at night so that people wouldn't have to be out in the wilderness watering their
They don't
bushes.
like water in their faces, though.
The coyotes?
Yeah.
Yeah, I just think, it sounds like, oh, great, I can water, and oh, wait a minute, I have to do it at 12 a.m. to 7 a.m.
No,
So
isn't it
I
from
think that
5
it needs
p.m.
to
to
be
9
refined a
p.m.?
little
Yeah,
bit.
and 12 to
Right.
7.
What
Yeah,
happens
5
from
I
9
agree.
to
Some
12?
People work in the evenings, and so they come home, and it could be a little bit more flexible. Hand watering does not use a lot of water. And to extend it a little bit so people can pragmatically not lose some expensive grass in small areas would be nice. So anyway, that's all I have for now, but I would hope that we get a handle on the actual number of irrigation systems in town. I think the data is available. Thank you.
Yep, thank you, Elaine. I assume you brought this to the select board, who are the water and sewer commissioners, I guess. I'd also say that there's a water and sewer advisory committee, which has been kind of defunct, but I know they have some new members, and they're going to become active again. So that's a committee you might want to bring your thoughts to as well, because I think they're getting active and they'll have some input.
Yeah, they had met jointly to come up with this ban. And, you know, there had been discussions about various things, about really getting a handle on it, but it seems to have fallen through the cracks in terms of really identifying who people are that are using inordinate number of water, because you're not going to be able to see it from the street. You know, the people on the street, you can see it, but there are a lot of interior lots that are watering. And apparently the data is available to get those overnight numbers. And then we could get a handle on who's not complied with putting in an extra meter or digging a well.
Okay, thank you.
Thank you.
I just wanted to clarify that outdoor watering is limited to Monday, Wednesday, or Friday by handheld hoses or watering cans between midnight and 7 a.m. or between 5 p.m. and 9 p.m.
Right.
So you can,
Well, I
can do it before it gets dark out.
I have a question. The comment was made before by Elaine that a homeowner who uses water for irrigation gets charged more by the town.
If they have put the meter in.
If they have.
If they put the meter, and they're not using well water, they're using town water.
Correct.
And they put the meter in, and then the town can calculate how many gallons they're using for irrigation of the town water.
Right.
And then they get billed accordingly.
At a higher
Rate than what they would do for household water use.
Correct.
But there's no fee or anything for a homeowner who has a private well,
Right.
nor are they required to put in a meter, true? Because it's their own system. Okay.
Elaine's issue is that there's 450 meters that have gone in. People have voluntarily come forward, say, I have an automatic irrigation system. There's another 800 who haven't come forward, don't have the second meter, and aren't getting charged extra for it.
Now, who've self-reported but not put a meter in?
No, I think some people haven't even self-reported. They don't have a meter, they don't get charged. So Elaine's issue is the town needs to track down these other people who have an automatic irrigation system on town water and make them put in a meter and start charging them.
Okay.
To be fair.
I get it.
That's her point, I think, her main
Okay.
point.
Thank you.
Okay, other,
Before we
Carol
adjourn,
Gordon.
I was just,
Yeah, minutes.
had a lot to say tonight.
You don't want to say anything, but.
Right, exactly. There's just one more thing. I see in our packet, we had a certified letter that went out as a complaint to Elliot Timberkin. And I was just wondering what has happened with that. He had 7 days.
Yeah, that was under correspondence. We sent a letter. There was a lot of rubbish and garbage bags as well in the yard. I did I emailed him. He lives in California. He's owned this house for many years, and he does not live in state. So I've had
I
several
remember this.
several contacts with him over the past 15 years or so. And he has brought a dumpster in.
Okay,
The dumpster was filled and removed. Most of the stuff has been removed from the yard. We are trying to keep an eye on it, though.
okay, so he's taking action.
Yeah,
Yes,
or he's
we're
gotten
keeping an eye on
his
him.
tenants to take action, probably.
he's being responsive.
Yes, he's being
okay.
responsive.
All right, and we'll keep an eye on that. Right.
Yep.
Okay, I guess we can move on. We have some minutes from July 18th. Anyone have revisions or additions? And if not, can I get a motion to approve the minutes?
I'll make a motion to approve the July 18th, 2022 minutes.
And somebody to second?
I'll second.
Ed gets
Carol.
it.
And then a vote to approve the minutes of July 18th. We can probably do it a voice vote. All in favor, say aye.
Aye.
Opposed, say no. Okay, then the minutes are approved. And then, if there's no other comments or new business or something from the public, can I get a motion to close the meeting?
Make a motion to adjourn.
I'll second.
Okay, and we can take a voice vote. All in favor of adjourning the meeting, say aye.
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 With pleasure.
And against? No? Okay, good. We are adjourned.
All right.